Hello all, this is Dr. Alsup, and in this dissection video we are going to talk through how to identify the vasculature associated with both the abdominal wall and those associated with the intestine. And so let's start with the abdominal wall first, which is all about the epigastric vasculature. We actually saw one of these in the thoracic wall dissection, the superior epigastric, which I am kind of outlining that vasculature right there. The superior epigastric artery is one of the terminal branches of the internal thoracic artery, and it's the one that descends into the abdomen, and you can see a bit of it here. But the dominant supply for the abdominal wall, as you can see here by the size, is the inferior epigastric artery. And then of course the vein is going to drain the similar area. The inferior epigastric artery is a branch of the external iliac artery, and these arteries will anastomose or communicate deep to the rectus abdominis, which you can see here has been reflected inferiorly. You'll also be able to see this vasculature when the abdominal wall has been reflected. So if you think about reflecting the anterior abdominal wall inferiorly and looking at the deep surface, you can still see the inferior epigastric vasculature either through the lateral umbilical fold, or if the peritoneum's removed, like in this particular image, you can see it quite well. And always remember that the inferior epigastric vasculature is going to be located medial to the deep inguinal ring. All right, moving to the deeper viscera, and recall that the superior mesenteric artery, or the SMA, which you will often hear us refer to it as, is going to be the main blood supply to structures derived from the midgut. So this includes the majority of the small intestine and a good amount of the large intestine too. The SMA is large, and it's relatively long as well. Particularly in comparison to the celiac trunk, which we'll talk about in more detail in other sessions. And that celiac trunk is going to supply the foregut. Branches that come off of the SMA towards the left are going to be branches that are destined for the small intestine, whereas branches coming off on the right are going to be more heading towards the large intestine. And we'll talk about those in more detail in a moment. So you can see the multiple branches, or the multiple jejunal and ileal branches of the SMA heading this way. And as you will see in the next image, these branches will produce these very complex arterial arcades within the mesentery of the small intestine. The SMV, which I'm outlining right now, is typically located just to the right of the superior mesenteric artery, and is typically fairly large in caliber, kind of similar to the artery. And we'll see this vein again as we talk through a bit more of the structures. If we remove some of the viscera, it's a little bit easier to see. And real quick before I move on, here are some of those arterial arcades that we were talking about that forms within the mesentery, and that goes to supply the small intestine. So it's really complex in this region. The veins will do a similar thing. Okay, so in this image, some of the small intestine has been removed to focus a bit more on the blood supply on the right side of the large intestine. Here is the SMA again. Here is the SMV. And note that the transverse colon has been reflected superiorly, almost to where you can't see it. You can see a little bit of it right there. So the transverse colon has been reflected superiorly. Typically, the most inferior branch of on the right for the SMA is going to be the ileocolic artery, right here. And it also tends to be one of the largest branches of the SMA. The ileocolic will supply predominantly the cecum, but it will also send branches to the ileum, and also will give off branch to the appendix, which you can see right here. So that would be the appendicular artery right here. Now, before I move on to the next branch, let's talk a little bit about the marginal artery, which I'm going to kind of trace here, and it will extend all the way over towards the left side of the body as well. The marginal artery can be seen throughout the inferior border of the large intestine, and all of these branches of the SMA and of the IMA on the other side that will send branches to the marginal artery that will directly supply the large intestine. So you'll see it kind of throughout the whole span, or almost the whole span of the large intestine. Occasionally there'll be kind of breaks in the marginal artery, but oftentimes it'll pick back up again. Okay, moving on, you have the right colic artery, which will supply the ascending colon. In this case, it's coming off of a common trunk with the ileocolic. And you can see extending to the marginal artery. And lastly, on this image, you can see the middle colic artery, which is a bit out of place because recall the transverse colon has been reflected superiorly. Okay. In this view, we are looking a bit more inferiorly than we were in the previous image. Here is the SMA. And as we move inferiorly on the descending aorta, or the abdominal aorta, you can see what I'm outlining right here, the IMA, or inferior mesenteric artery. Now, you can see coming off of the IMA, three major types of branches. You will have the left colic, which will supply the descending colon through the marginal artery. You can see a bit of the marginal artery right here. The sigmoid arteries, which I'm outlining right here, are going to, as its name would suggest, supply the sigmoid colon. These branches will descend inferolaterally, and typically there are more than one sigmoid artery, as is the case here. And the branch that descends a little bit more towards the midline is going to be the superior rectal artery. And it often looks like a continuation of the inferior mesenteric artery. And right here you'll see a bit of the inferior mesenteric vein, and we'll talk about this in a bit more detail in the next image. All right, this last image is a good review image. I would take some time on your own to kind of see what you can label, and then you can kind of refer back to the BlueLink images to see how you did. But there's a few things I really want to hone in on this image. First, I want you to note again the marginal artery and how it kind of extends throughout the whole inferior border, or the majority of the inferior border of the large intestine. The transverse colon again has been reflected superiorly, so there is a bit longer of a span there than would be typical. But what I really want to draw your attention to here is to review the SMA and IMA and look at the same named veins. So the SMA, again, so your SMA right here, is going to be superior to the inferior mesenteric artery, which is located right here. The SMA has a prolific amount of branches, all right, compared to the inferior mesenteric artery. There's going to be branches all over the place in terms of the SMA. And the SMV, or the superior mesenteric vein, is very closely associated with the SMA. So it's just to the right of the artery. The inferior mesenteric artery is smaller in caliber, so it's going to be smaller, it's going to have less branches. And I always like to think of the inferior mesenteric vein, or your IMV, as kind of doing its own thing. It's comparatively quite a bit more lateral to the IMA than, say, what you have in comparison to the SMA and the SMV. So the inferior mesenteric vein is a bit more lateral to the inferior mesenteric artery. The IMV's most typical pattern has it draining into the splenic vein, which is going to be kind of deep to these structures right here. The splenic vein and the superior mesenteric vein will join to form the hepatic portal vein. Excellent. That was a lot of vasculature fun. Thank you for your time and attention here, and please reach out if you have any clarification questions. Have a great rest of your day.